في تيمة، في منظومة مجموعة محاضرات معمولة برعاية الملتقى الطبي الإنساني Humanitarian Health Hub. الهدف منها دعم وإعطاء معلومات للممارسة الطبية زي ما قلت من دقيقة في الأماكن قليلة الموارد، بحيث ان الناس تقدر وهي في بيوتها وهي في مستشفيات مش مجهزة تعمل نوع من الرعاية الطبية. طبعا مش هتبقى رعاية كاملة لو في زي الأماكن اللي مجهزة بأدوية وتجهيزات وبتاع، لكن إيه، ما لا يدرك كله لا يترك كله، ودي قاعدة. فمجموعة المحاضرات هيبقى فيها ازاي الناس تعمل تأهيل بعد الإصابات في المنزل، بتكلم المحاضرات القادمة. ازاي الناس تعمل ووند كير، ازاي تعمل اهتمام بالجروح في المنزل، ازاي الناس تقدر تعمل رعاية بالأطفال حديثي الولادة لو واحدة مضطرة تولد في المنزل. دي مجموعة من المحاضرات إن شاء الله هتبقى يعني بعد كده. المحاضرة النهاردة الحقيقة أنا حسيت إن هي هتبقى إن شاء الله افتتاحية قوية أوي، لأن هو الموضوع اللي هو طب الأعشاب، هو فايتوثيرابي، ده طب، ده علم وله قواعد. وأنا أقدم الأستاذ الدكتور سليمان إرسوي. It's my honor, it's my pleasure to introduce Professor Süleyman Ersoy. Professor Süleyman, he is an assistant professor from Istanbul Umraniye University, and he is the head of ethical committee of complementary medicine there, and he has a great experience about phytotherapy, herbal therapy on medical evidence base. And really, I was honored to learn hijama in his department 3.5 years ago. And really, he's a wonderful lecturer. He had great experience in complementary medicine. I will complete a few words in Arabic about herbal medicine. Then I will deliver the microphone to Professor Süleyman. هو ليه الهيربال ميديسين او الفايتوثيرابي ده مهم؟ اولا ده طب قديم، والقدم في حد ذاته دليل على ان هو طب ذو جوده وذو فاعليه. مفيش يعني تجربه انسانيه بقى لها 4000 5000 سنه والناس مصممه عليها الا اللي هي وجدت فيها فايده. والحاجه الثانيه ان هي موجوده في دول الهيلث كير سيستم، المنظومه الصحيه عندها لن تسمح الا بطب يعني مبني على ابحاث ومبني على مراقبه. موجوده في الصين، موجوده في نورث امريكا، موجوده في حتت كتيره بره. والدبليو اتش او زي ما احنا هنشير في الاخر بتريكوجنايز، بتعترف بتنوع الطب التكميلي اللي من ضمنه الهيربال ثيرابي. طيب احنا يعني ان شاء الله في نهايه هذه المحاضره احنا مش عايزينها محاضره معلومات، لا احنا عايزينها محاضره عمليه. يعني الدكتور سليمان هيحدثنا على اهم الاعشاب اللي ليها فاعليه، واحنا عملنا بحث قبليها سيرش، شفنا ايه الابحاث الموجوده دلوقتي في غزه، بحيث ان اهلنا في غزه لما يستمعوا يجدوا ان شاء الله فرصه ان هم يطبقوا استخدام للاعشاب بنظام طبي دقيق، يعني بمعنى في جرعه، في مده، في توقع تاثير. وده الهدف من المحاضره النهارده. طيب احنا الحاجه المهمه ايضا في قصه الهيربال ميديسين بوجه عام ان هو طب الى حد بعيد قليل التكلفه. وقله التكلفه دي الحاجه مطلوبه جدا. العالم كله بيتكلم على ازاي الناس تقدر تقدم طب فعال في نفس الوقت قليل التكلفه. لكن على الناحيه الثانيه هو ما ينفعش ان انا ادخل على الانترنت واقول مثلا العشب الفلاني تك تك اقول يلا ايه انا اخده، لان زي ما بقول ده طب. ومشاكل ان انا اخد حاجه من الانترنت او اشتريها من عند العطار من غير ما ابقى فاهم الاستخدام وفاهم الجرعه، لا اما يبقى عندي توقع عالي قوي ولما ما الاقيش نتيجه احبط، او ممكن اخذ حاجه ويبقى فيها اثار جانبيه او فيها شوائب، وفي نفس الوقت دي مش هتبقى حاجه امنه. فده زي اي طب محتاجين ان احنا نستمع لخبير يقول لنا نستعمله ازاي وناخد ايه. وعشان كده موجود في الاسواق حتى بعض اعشاب بتباع في صيغ يعني في شكل دوائي. اخر نقطه بقى من المحاذير في قصه التعامل مع الكومبلمنتري ميديسين بوجه عام، ان الكومبلمنتري ميديسين ده زي ما بنسميه ادجوفنت ثيرابي، يعني ده حاجه مكمله. ما ينفعش ان انا اوقف واقول ان انا هستبدل مثلا دواء الضغط بكذا او كذا، بمثلا اعمل حجامه، بمثلا اعمل كذا. فدايما الطب ده اسمه كومبلمنتري تكميلي وليس الترناتيف بديل. مع اقرارنا ان بوجه عام في الطب في علامات خطر ما ينفعش اقول هجرب معاها حاجه. الشخص اللي عنده نزيف، اللي عنده الم شديد بقاله فتره، دي اعضاء، دي معذره اعراض يجب التعامل معاها سريعا، ولا اقول ان انا هاخذ طب تكميلي او اي نوع من الدواء. يجب ان الجا لمراكز طبيه. هنبدأ إن شاء الله تعالى. So our dear Professor Süleyman, the microphone is yours and you are welcome to start your wonderful lecture إن شاء الله. Please Dr. Süleyman.
شكرا يا شيخ محمد. السلام عليكم على جميع الحاضرون. بسم الله الرحمن الرحيم. الحمد لله رب العالمين. الصلاة والسلام على رسولنا محمد وآله وصحبه أجمعين. Thanks a lot for the organizers of this lecture. I will first thank them with my all sincere, because they gave me this opportunity to share my experiences in phytotherapy. I am a family physician, specialized in family medicine, and I have been practicing medicine at about 30 years. I have been working as a doctor in the government and hospitals for 30 years, and I have been practicing complementary medicine more than 15 years. As
sorry, my dear brother, I forgot to say a very important sentence, that after each plant, each herbs, we will make an Arabic translation. So people just have some patience. After Dr. Süleyman will finish the first herb, we will make Arabic translation. Thank you so much.
Okay. So I'm glad to join this meeting. Inshallah, I will try to make some shares from the current knowledge on some selected herbs. Okay, Bismillah. Phytotherapy means treatment with plants. The name given to treatment with plants or herbal medicine. In 1991, World Health Organization defined herbal medicine as a finished label medicine product or preparation containing herbal drugs or mixtures as such, or in the form of different preparations. I want to say what drug is. It is very important as a terminology. Drug does not mean the drug we use now in the current medicine. In phytotherapy, drug means the part or organ of a plant which is used in treatment. For example, we use the flowers of Matricaria, which is babunech, I think in Arabic, and the leaves of mint. So the drug of mint is leaf of mint. Yes. I think you will make some translation. Oh, at the end of every herb. Okay, okay. 80% of people use herbal medicine at some point in their lives. For example, this is almost 100% in our country, and I am sure the rate is very close to our country in Egypt, because in those countries which are close still to their traditional roots, they almost use, every people almost use at least once or more than this in their lives, those herbal drugs. And for example, 85% of the Asian and African population use only traditional herbal treatment in their lives regarding for their treatment of their diseases. Now, I want to begin with ginger, which is Gingiber officinalis in Latin, and I think it's zencebil in Arabic. We call zencefil in Turkish, coming from Arabic root. By the way, I want to say that some of these slides, I have been giving lectures on Tıbbun Nebevi here in Turkey. Some of these slides are the same slides from that lecture. So, for example, I begin with zencebil first because it is one of the main herbs which has been mentioned in Quran. I think it is Surat al-Insan. It says, Bismillah, وَيُسْقَوْنَ فِيهَا كَأْسًا كَانَ مِزَاجُهُ زَنْجَبِيلًا. Yes, the name of the drug is Gingiber officinale in its Latin name, and it's a plant that belongs to Zingiberaceae family. This is a huge family. The main drugs included in this family is turmeric and ginger. And this plant is tropical, grown naturally in tropical or subtropical climates such as China, India, Indonesia, Vietnam, and Japan. And has been used for medicinal purposes, especially in Asian countries, including India and various Arab countries for centuries. Also in my country, in Turkey, it has been, although it does not grow naturally, by that famous traditional spice way, it has been imported to Turkey for centuries, and it is being used still in our country. It can be used raw or cooked. It is also available in fresh, dried, and powdered forms. By the FDA, American Drug Association, it has been reported as a healthy substance with very few side effects. Its rhizomes, which are roots, are used in treatment, and its rhizomes contain its essential oil, which gives its characteristic scent up to 3.3%. The composition of its essential oil, by the way, I hope the audience know what essential oil means. The other name we use for essential oil is volatile oil. These oils are a little bit different from the fixed oils which we use in cooking, such as olive oil. These oils, as we can understand from its name, are volatile. It means they evaporate after a few minutes when you, for example, apply it to a surface or to a tissue. It begins to evaporate. So these essential oils, volatile oils, are very important in phytotherapy. And a sub-branch of phytotherapy, which is called aromatherapy, is the therapy, is the treatment done with these essential oils. So the essential oil of ginger, zanjabil, is up to 3% of its rhizomes and contains monoterpenes, neuralginyl, and other ingredients. As for the traditional use of zanjabil, the Chinese have used ginger for at least 2,500 years as a digestive aid, an anti-noise remedy, and to treat bleeding disorders and rheumatism. It was also used to treat baldness, toothache, snake bite, and respiratory conditions. In traditional Chinese medicine, in TCM, ginger is considered a pungent, dry warming herb to be used for ailments triggered by cold and dumb weather. What does warming mean? In traditional medicine systems, especially, the diseases are caused by coldness. Sometimes warm, sometimes cold are the cause of the diseases, especially the infections which we experience during winter, such as common cold, flu, are the diseases caused by cold in traditional medicine. So those herbs, such as ginger, zanjabil, are very important because they warm the body. And this ginger is one of the main warming herbs in phytotherapy. And also in Ayurveda, Ayurveda is a traditional Indian medicine. It's used to block excessive clotting, for example, for heart conditions, cardiovascular conditions, and it's also used to reduce cholesterol and fight arthritis. And in traditional Arabic medicine, zanjabil is considered as an aphrodisiac. Then it migrated to Europe by Greek and Roman times. And for example, the Greeks wrapped ginger in bread and ate it after meals as a digestive aid. A collective physician of the 19th century relied on ginger to induce sweating, improve the appetite, curb nausea, and as a topical counter-irritant. Nowadays, also it's used as a nausea remedy, as an antispasmodic, and to promote warming in case of chills. German Commission, this book is very important in phytotherapy science because Commission E and the other famous monographs is ESCOP monographs. These two monographs are very trusted scientific sources for phytotherapeutic knowledge. This German's Commission E monographs have approved the use of ginger as a treatment for dyspepsia and prophylactic against motion sickness. Zanjabil contains approximately 50 different antioxidant components. It has been reported to be effective in many conditions, including diabetes, rheumatoid arthritis, MS, multiple sclerosis, cancer, atherosclerosis, psoriasis, osteoporosis, and Alzheimer's. One of the prominent effects of ginger, zanjabil, it acts like a non-steroid anti-inflammatory. So you can use it as a painkiller. For example, for rheumatic diseases, for rheumatism, for osteoarthritis, for example, for gonoarthritis, you can use zanjabil because it has no side effects on gastrointestinal system. It does not disturb your stomach. It does not promote peptic ulcers. It is very effective. Plus, it has very, very few side effects. Its main and approved use, which means I will use this term throughout my presentation, throughout my lecture. It's very important to describe it to the audience. What approved means, which has enough clinical clue that support the use of this herb in those indications. So its main and approved use in the treatment are nausea, vomiting, and motion sickness. For example, I want to share my experiences. Those patients who have come to me during my MD, I mean medical doctor experience, which have asked me to recite them, to prescribe them an antiemetic. I was just advising them to take some ginger, some zanjabil, boil it, then filter it, and take fill it to a bottle. Take the bottle, I mean the zanjabil extract, the aqueous extract of zanjabil, which means we extract it after boiling it with you, and during your journey, just drink throughout journey with small amount. It will be better than most of the antiemetics we use in current medicine. So you can advise, and you can use it for motion sickness, for nausea, in any kind of disease, zanjabil, and all those conditions I have mentioned here. Okay, it's widely used in colds. For example, if you catch cold, for example, we are now in Turkey, just experiencing a very cold weather. It's good for cough and phlegm. And one other property of zanjabil, it's a general cleanser of the body, detoxifies the body. Plus, it strengthens the immune system. It relaxes the liver, gallbladder, and digestion. Current literature, we can, when we search the literature currently, we can see all these activities has been studied, and zanjabil has been found effective and beneficial in these conditions. For example, it has a great antioxidant activity. It has a great antimicrobial activity, such as antiviral, antibacterial activity, anti-diabetic, anti-cancer, anti-inflammatory activity, analgesic activity. As I mentioned before, you can use zanjabil as a painkiller. It is very safe, much safer compared to chemical drugs, and you can use it as an antipyretic. Plus, it has neuroprotective, renoprotective, and hepatoprotective properties, and you can also use as an atherosclerotic drug. How shall we use ginger? We can make a tea. Infusion means you just boil the water and pour on the drug, I mean the herb, and wait at about 5 or 10 minutes, then filter it and drink it. This is the infusion. We, for example, prepare our teas, I mean those black teas we drink every day in this manner, in this way. So you can prepare the ginger tea with a 2 and 5 gram tall fresh ginger root. You slice it or powder it, then you can make a tea from that. How shall we do it? We have to add a full glass of cold water, heat it up to the boiling degree, then boil it in a mild temperature for 5 or 6 minutes, and then drain it. And we have to drink it before it cools down. And also, ginger can be used as a spice. For example, spices containing ginger may be conveniently added into soups, in meat, and any kind of cheese, bread, salad, etc. What I want to say here, those herbs which we use as a spice or as a food as well are much more safer herbs than the other herbs, because we have been using for centuries, for thousands of years, these herbs as a food, as a spice, which means we use it, the therapeutic dose is much smaller to the...
الرحمن الرحيم، واهلا وسهلا بحضراتكم، كل عام وانتم بخير. النهارده هتكلم بسم الله.
Yes.
No.
I think
I'm sorry.
You have been translating it. Okay.
Yeah, I'm sorry. No, I'm sorry.
This is the end of this herb. Actually, you can translate.
Okay. Can I translate now?
Yes.
Okay. السلام عليكم. الدكتور سليمان اتكلم على نبات الزنجبيل ويسقون فيها كأسا كان مزاجها زنجبيلا. الزنجبيل يعتبر من النباتات النيئة، هو نبات بينتمي للعائلة الزنجبيلية، وبينمو في المناخات الاستوائية زي الصين أو الهند وأندونيسيا، وبيستخدم في أغراض طبية في الأماكن ديت وفي دول عديدة لعدة قرون. الجنزبيل يمكن استخدامه ني أو مطبوخ، وأيضا في أشكال ليه مختلفة، ممكن تبقى مجففة وبودر مسحوق. طبعا إدارة الغذاء والدواء الأمريكية يعني صنفته كأنه كمادة صحية بس ذات آثار جانبية قليلة. هو تركيبته الأساسية بتتركب من الزيوت، وبيحتوي على مركبات كيميائية وكيتونات بتساعد على العلاج. الصينيين هم اللي استخدموه بشكل كبير قوي لأكثر من 2500 سنة كعلاج للهضم والاضطرابات النزيف والروماتيزم وألم السنان والحالات النفسية. في الطب الصيني التقليدي برضو بيعتبروه ان هو يعني عشبة حارة جافة بتستخدم لعلاج الامراض اللي بيسببها الطقس او الاماكن الباردة او الرطبة. الجنزبيل بيعتبر في الطب العربي يعتبر نوع من انواع المنشطات الجنسية في الطب العربي، وايضا بيستخدموه لاغريق والرومان قبل كده. حاليا يعني بيستخدم الجنزبيل بشكل جلوبالي، بشكل عالمي، كعلاج للغثيان، مضاد للتشنجات، وبيعزز التدفئة في حالات البرد والرعشة. طبعا حصلت عليه موافقات كتير من ضمنها اللجنة الألمانية. وطبعا في بعض المنظمات اللي تم الإبلاغ عن فعاليتها في علاجه كداء للسكر والروماتويد والزهايمر وهشاشة العظام والصدفية وتصلب الشرايين، وبيستخدم في بعض العلاجات السرطان كمان. هو يعتبر ليه تأثير مشابه لمضادات الالتهاب الغير استيرويدية، وملوش أي آثار جانبية على الجهاز الهضمي، وبيستخدم بشكل رئيسي في علاجات زي القيء والدوار والغثيان. وبيستخدم في علاج في نطاق واسع برضو في علاجات البرد والسعال والبلغم، ومنظف يعتبر كمنظف عام للجسم، وبيساعد على إزالة السموم اللي موجودة في الجسم، وبيقوي الجهاز المناعي. بيشتغل على كذا مجال. هو يعتبر مادة نشطة ضد الأكسدة، ومضاد للميكروبات، ومضاد للسكر والالتهابات، ويعتبر يستخدم كمسكن للألم وخافض الحرارة. وأيضا ليه نشاط مضاد لتجمع الصفائح الدموية وتصلب الشرايين، ومضاد أيضا للسمنة، وواقي للأعصاب والنشاط المضاد للسرطان. بيستخدم في أنواع كتيرة، منها الشاي بيتم تقطيعه بأحجام صغيرة، ممكن يستخدم كبودر مع الماء البارد أو الماء الساخن، وبيتم شربه. وممكن أيضا بيستخدم كنوع من أنواع التوابل في بعض الأماكن، أو بعض الناس بيستخدمه على إنه توابل، بيستخدموه مع الخضار والفاكهة والسلطة ومعظم مكونات الأكل، وليه فوائد كتيرة في تحسين الهضم.
شكرا جزيلا باشمهندس محمود. هو حقيقة يعني thank you so much Professor Süleyman for this informative lecture. I want to highlight 2 or 3 points. يعني في نقطتين ثلاثة أنا شخصيا هحاول أدخل الجنزبيل بشكل ثابت في أكل وشرب. يبقى دي أول فايدة. الحاجة الثانية، من الواضح ان الدكتور سليمان بيؤكد قصة الغثيان والدوار بتاع الحركة، الناس اللي بتركب مواصلة وبتحس ان هي عندها دوخة، او بترجع اثناء ما بتركب طيارة او بتركب مواصلة، ده يعني فايدة ليها، وهو شرح ازاي بتستعمل. فقصة الدوار بتاع الحركة ده مهم جدا، واحنا كلنا مجربين قصة ان احنا نستعمل جنزبيل يعني في ادوار البرد والالام الروماتيزميه بوجه عام. شكرا جزيلا. Thank you my dear professor. Would you please shift to the second herb please? Thank you.
Okay. Bismillah. The second one is the from the same family, Zingiberaceae family, so it can be considered as the same drug, as the similar drug. As you can see from its picture, it is very similar to zanjabil, and it's curcuma longa, and it's turmeric in English. I don't know what you call is Arabic. It's something like curcumin, I think, in Arabic, or something like that. Anyway, this is turmeric.
It's called curcum.
Curcum, yes, yes,
Curcum.
curcuma, yes, curcuma is also its Latin name. This is a perennial herbaceous plant with yellow flowers, large leaves, and rhizomes. And like zanjabil, its rhizomes, which means its roots, are used in treatment. It grows in tropical regions of Asia, especially in Pakistan, India, China, and Bangladesh. For example, the traditional Indian medicine has been using this plant for more than 2,000 years. It contains up to 7% essential oil, which includes zingiberine, turmeron, and curcumin. It contains up to 7% curcuminate, especially curcumin. Curcumin is the main ingredient of this plant, and this curcumin has been studied in many studies in different conditions, and it has been found effective and beneficial in many diseases. And it has, for example, antimicrobial, anti-inflammatory, antioxidant activities. It is also immunomodulator, renoprotective, hepatoprotective, and hypoglycemic effects. For example, in 1985, a group of researchers revealed its anti-cancer properties. It's about 40 years ago, the first time curcumin's anti-cancer properties has been revealed. And for example, United States National Cancer Institute has been studying on more than 1,000 agents, and curcumin is one of the most promising agents, is one of the 40 most promising agents among these 1,000, which has been tested for its anti-cancer property. For example, there are many clinical studies investigating curcumin's cancer prevention and treatment. It is still limited, but compared to other herbs, we can say curcumin is one of the most studied and investigated herbal drug in cancer. In recent years, an increasing number of clinical studies have been initiated and are still ongoing on curcumin's properties. For example, in a phase 2 clinical study, which has been conducted on 45 patients, the effects of curcuma longa, curcumin, on peptic ulcer has been investigated, and it has been endoscopically shown that gastric ulcers disappear in 45%, 73% and 76% of cases after 4, 8, and 12 weeks, respectively. Which means the duration of the treatment with curcumin also increase. When the duration increases, also the effectivity increases. For example, in another clinical study, curcumin was given orally to 126 patients with colorectal cancer, and weight loss decreased in these patients, and apoptosis, which means cell death of the cancer tumors, increased, and serum TNF alpha levels were shown to decrease. Another clinical trial, which included 45 patients with colon cancer, 4 grams of curcumin has been given a day for 30 days, and a 40% reduction, decrease in the number of lesions was observed. In many conditions, including especially these ones, which are nasopharynx cancer, lung cancer, hepatobiliary cancers, breast, stomach, colorectal, and prostate cancer, endometrium, and hematopoietic cancers such as leukemias, curcumin have been found effective. What is important for curcumin? It's an agent that can be used safely even in high doses. This is true not also for curcumin, also for ginger as well, because as I mentioned, they are also used as spice and as a food for centuries, which means we use a herb as a food far more doses when we use it as a treatment. Curcuma is a product that can also be used as a food supplement in patients in the risk of group for oncological diseases, such as smokers, those with precancerous lesions, those have a cancer history in their family. It can be also recommended to cancer patients because it's a safe plant. How to use? You have to drink the tea, which has been made from 3 grams of the curcuma root, either in powder form or by boiling the cut piece for 30 minutes. What I have to mention here, if we use it in a powder form, you can just infuse it. What I mean, you can just prepare it as a tea. You boil the water and pour on it and wait for 10 minutes by, of course, closing the cup with something so that it will not evaporate. But if you use the root itself by cutting small pieces from it, you have to boil it at least for 10 minutes, because in the root form, the herbs is a little bit more strong. So you have to boil it at least for 10 minutes so that the ingredients can pass to water, can be extracted to the water only by boiling. Before ending these 2 herbs, I want to say that, as I mentioned, I am a family medicine. My specialty is in family medicine. Preventive medicine is a sub-branch of our specialty. So I want to highlight and emphasize that these 2 herbs, which has also been mentioned in Surah Al-Insan, because curcuma and zingiber are both from the zingiber family, zanjabil family. These 2 herbs, which have been using, which we have been using for centuries as a spice and food as well, can be safely used as a prophylactic medicine. Those who do not have any disease, not only those risk populations, all of us, I think, have to use these 2 herbs in our daily life. I think we might accept this as a routine of our daily life, to drink at least a cup of ginger or a curcumin tea every day, or maybe before breakfast or before we go to bed, because it's better to drink all herbal teas when we are hungry, to empty stomach. So I strictly advise the use of these herbs, these 2 herbs, in our daily life as a prophylactic medicine, as a preventive medicine. Okay, please.
Thank you so much, my dear Professor. I have one comment before Engineer Mahmoud will start his translation. That I will say it in Arabic. التحدث على علاقة الأعشاب بالسرطان بالقطع لا يعني إن لو واحد عنده شك في سرطان أو هو عنده متشخص سرطان ويحتاج جراحة، إن إحنا هنقول لأ مش هنعمل الجراحة أو مش هنمشي تبع البروتوكولات العلاجية. لكن زي ما تفضل الدكتور سليمان، إن إحنا بوجه عام نجعل الهربس دي كوقاية وبناخدها زي ما قال على معدة فاضية، ده حيث انها امنه، دي وسيله وترند ومنهجيه جميله. الحاجه الثانيه، ده رايي الشخصي كجراح قديم يعني، ان الحالات اللي بنعمل فيها بالياتيف ثيرابي. يعني ايه بالياتيف؟ يعني مريض متشخص ان عنده سرطان منتشر، وبالتعبير الطبي الناس بتاخد علاج كيمائي for better quality of life عشان تحسن الحياة بأعراف الطب، الجزء اللي فاضل له من عمره 6 شهور سنة. أنا لا أرى مفيش مشكلة خالص إن إحنا نستعمل الكومبلمنتري ميديسين بشتى أنواعه in addition لأي علاج كيميائي منصوح به. حبيت أعلق. اتفضل يا باشمهندس محمود.
تمام. دكتور سليمان بيتكلم عن نبتة الكركم، وهي أو بتسمى أيضا بالزعفران الهندي، وهي بتستخدم بشكل كبير في الطب التقليدي في الهند لأكثر من 2500 سنة. الكركم ليه خصائص كتيرة، منها أن هو مضاد للميكروبات ومضاد للالتهابات ومضاد للأكسدة، واقي للكلى والكبد، وله تأثير في خفض نسبة السكر في الدم. سنة 85 اكتشف كاتن أو كوتان إن خصائص الكركمين مضادة للسرطان. برضو في الدراسات السريرية أو الكلينيكال ترايلز اللي حصلت مع الكركمين، يعني اتحققوا ان هي ليها دور في الوقايه من السرطان وعلاجه، يعني بدرجه محدوده جدا يعني. وفي السنوات الاخيره بقى يحصل عدد متزايد في الدراسات السريريه ليه، وبيدوروا في الفعاليه بتاعت ماده الكركمين، والدراسات دي ما زالت مستمره. في دراسة حصلت في فيز 2 أو مرحلة تانية من السرطان، حصلت على 45 مريض، وتم تقييمهم إن تأثير الكركم ليه تأثير قوي جدا على قرحة المعدة. النتائج دي ظهرت بنسبة يعني أثبتت إن قرحة المعدة اختفت بنسبة 48% في مدة 4 أسابيع، و72% اختفت بعد 8 أسابيع، و76% منها اختفى بعد 12 أسبوع من العلاج بالكركمين. برضو من ضمن التجارب السريرية اللي حصلت إنه الكركمين بقى يؤخذ عن طريق الفم ل 126 مريض عندهم سرطان قولون وسرطان المستقيم. لاحظوا ان في انخفاض بيحصل للوزن لهؤلاء المرضى في الفتره اللي بتبقى قبل العمليات الجراحيه، وان ان معدل الخلايا السرطانيه بيموت بشكل معدل متزايد بشكل كبير. برضو في دراسة تانية حصلت إن على بعض المرضى، بالظبط على 44 مريض عندهم سرطان القولون، وخدوا حوالي 4 جرام من الكركمين يوميا لمدة 30 يوم، لاحظوا إن نسبة الآفات أو الخلايا السرطانية اتخفضت بنسبة 40%. الكركمين فعال في الوقاية من أنواع كتيرة من السرطان، زي سرطان البلعوم وسرطان الغدة الكظرية وسرطان الجهاز الكبدي وسرطان الثدي وسرطان المعدة وسرطان القولون والمستقيم والبروستاتا، وأيضا سرطان بطانة الرحم وعنق الرحم وسرطانات الدم. الكركمين بيستخدم كعامل أمان، ليه عامل أمان في استخدامه حتى لو هيتاخد بجرعات عالية، وبيستخدم ايضا كمكمل غذائي للمرضى برضو اللي عندهم امراض سرطانيه والمدخنين، او الناس اللي هم عندهم او اللي هم محتملين يبقوا مصابين بالسرطان او مؤهلين ان هم عندهم يجي لهم سرطان بشكل اكتر من غيرهم. وايضا تم التوصيه ان من كذا جهه انه يعتبر نبات امن في استخدامه، وبيتم شربه برضو او اخذه عن طريق ممكن الاشكال منها اللي هو شكل البودر، او عن طريق غليه في الميه لمده 10 دقائق.
تمام شكرا جزيلا. تسلم. Thank you so much my dear Professor Süleyman. We have a comment from Dr. Ahmed Shaban regarding الجنزبيل that الجنزبيل may affect platelet so it is not advised in patients with thrombocytopenia. الناس اللي عندهم نقص في الصفائح من الافضل ان هم ما ياخدوش جنزبيل. شكرا دكتور احمد. Okay, now we will shift to the ان الابرار يشربون من كأس كان مزاجها كافورا.
Yes, this is from the same surah, Surah Al-Insan. إن الأبرار يشربون من كأس كان مزاجه كافورا. This kafur is essential oil, which can be, I don't know, I cannot continue to the next slide. Do I have to reshare it, Mahmoud?
When you press it, it doesn't move.
No, you don't.
Okay, just stop share and reshare it. Okay.
Okay. Okay. Yes.
Yes.
Thank you. So, yes, this kafur is an essential oil, an ingredient and essential oil, one of the main ingredients in various plants essential oil, including this camphor tree, which grows in subtropical areas, this sage, rosemary, and lavandula. And I want to talk about sage here. Sage, it belongs to Salvia family. There are many subtypes of subspecies of sage, including Salvia officinalis, which does not grow naturally in Turkey and in Middle East, but is endemic to Europe. But at least 86 species which grow naturally in Turkey, and 40 of them are endemic to this area, especially to Mediterranean region. And the main species which grows naturally in our country is Salvia triloba. It is also known as Greek sage in the current literature. The parts used in Salvia are its leaves and above grounds, which we call it Herbal salvia. This plant contains up to 3% essential oil, which include, and also 5% rosmarinic acid, tannins, flavones, and terpenes. Its essential oil contains 60% eucalyptus, 80% camphor, and less than 5% thione in its essential oil. When we compare the camphor content of two famous salvia species, it is much higher in Salvia triloba when compared to Salvia officinalis, which is the European sage. But in the European sage, which is Salvia officinalis, the thione content is quite high. And this compound exhibits toxic effects in high amounts. For example, if you drink a lot of sage containing with a huge amount of thione as an ingredient in its essential oil, you can, for example, experience some spasms, even if you are loyal to epilepsy. Those patients who are suffering from epilepsy cannot use salvia, but especially that spice, which is that species, which is called as Salvia officinalis. Its traditional use includes astringent, wound healing. It's also used in night sweatings and gastrointestinal disorders. Gargling with salvia with sage is effective in all infections of the mouth and throat mucosa. For example, pharyngitis, stomatitis, and gingivitis, and other inflammations of the oral mucosa. You can use gargling of sage tea. Sage tea is one of the first options for upper respiratory tract infections. It has anti-inflammatory, astringent, and antidiuretic effects on the mouth and throat mucosa. Especially the antibacterial, the antiviral, antifungal effects of its essential oil have been shown in many in vitro studies. In a randomized controlled trial using salvia spray, the 15% spray of salvia has been found to be very effective and safe in acute pharyngitis. I want to give some examples from my own practice. When I was working as a primary care physician in Istanbul in a center, in a center, family center, I have been using sage tea as my first prescription in upper respiratory tract infections. Almost every patient I have been advising, of course, those maybe those are I have been excluding those who can see or experience some side effects from salvia, such as pregnancy, but most of them have been benefiting from salvia tea. For example, those who are suffering from pharyngitis, from dry cough caused by pharyngitis or inflammations of the oral mucosa can easily and safely use sage tea and will 90%, according to my experiences, will benefit from its tea. In a huge number of, including huge number of patients, more than 150, with acute sore throat, they have used salvia and echinacea, another herb which is being used for upper respiratory tract infections, or the chemical one which is being used in the current medicine, chlorhexidine lidocaine spray. They have compared these two sprays, and when considering the treatment responses rates after 3 days, 63% in the salvia group improved, while 57% in the chlorhexidine group improved. In line with clinical studies, it has been approved in dyspepsia, excessive sweating, and gargling in upper respiratory tract infections. Those two famous monographs approved its use in stomatitis, in gingivitis, in pharyngitis, and in nasal and oral mucosa inflammations. How to use? We can use up to 6 grams of the drug daily. What we have to do, we have to infuse 1 teaspoon of the drug into 1 glass of water. Apart from brewing, gargling also can be done by adding 2 or 3 drops of its essential oil to 100 milliliters of water. If the dose exceeds 50 grams at a time, it might cause tachycardia, hot flashes, cramps, and imbalance. So there is a toxic dose of sage, but while regarding the therapeutic doses, we do not see those side effects, which is up to 6 grams a day. One thing I have to mention about preparing the sage tea, sage is a very sensitive drug, so we do not have to infuse it. We must not boil it first. We cannot boil sage. We can only infuse it. We can only brew it. I mean, you have to just pour the boiled water onto drug and we have to wait not more than 5 minutes. Otherwise, those toxic substances can be extracted to the water. Just boil the water, pour on the drug, and wait no more than 5 minutes. Then drink it before it cools down. Okay, please, Mahmoud.
Okay, I will take this. I mean, translation, because actually now it's 9:08 and we want to finish at 9:30. So I will just highlight few points. Allow me, my dear brother سليمان. هو الدكتور سليمان تحدث على الكافور، وان في انواع مختلفة منه، وواضح ان اهم فايده له منطقه الفم والبلعوم والسبرايز المطهره وضد الالتهابات، وقارنها بكلور هكسدين اللي هو الغسول المعروف، وقال ان هو اكثر فاعليه. لكن النقطه اللي هي كانت مهمه وقال لنا عليها ان هو مفيش معامل امان عالي زي الجنزبيل مثلا، فلازم ان احنا ناخد بالنا من ان هو يعني ايه يعني ناخده بجرعه قليله وما نزودهوش. وفي كم تساؤل في الشات. دكتوره ميراندا انا عارف انها من المهتمين، بتحدث ان هو ممكن يكون دهان، وتحدث قبل كده على الكركمين وقالت عليه ان هو المسمى مشروب الذهب الاصفر. فننتقل لنكست هيرب عشان نستفيد بالوقت. اوكي ماي دير بروفيسور, would you please start the second herb or the next herb please?
This is thyme, Thymus vulgaris. I think you call it zahter in Arabic. It's a short bushy plant in the mint family, which is found all over the world. All it's native to southern area. In traditional medicine, it's used for a wide range of health conditions, and it has been used for centuries. In traditional medicine, also one of the safe plants, which is considered safe. Also, it has been used as a spice to add flavor to food, and also it's available in its capsule form or as an essential oil. The plant, thyme, contains many active compounds, one of which is thymol. And thymol is a phytonutrient which is thought to possess antioxidant, anti-inflammatory, pain-relieving, antimicrobial, and anti-tumor properties. It has been used for long as a home remedy for cough and other respiratory conditions. For example, a study used 18 healthy participants to test the effects of thymol on coughing. After using this nasal spray, the study participants underwent several tests to evaluate their urge to cough, the number of coughs experienced, and the threshold by which coughs occur. And the spray containing thymol significantly reduced the number and severity of coughs, as well as the overall urge to cough. And also some participants reported that it has a pleasing cooling effect. Multiple studies have found zahter theme to have strong antioxidant activity due to its components like thymol, terpenes, and carvacrol. Carvacrol is also another ingredient which is found in its essential oil. Its essential oil is often used for aromatic and therapeutic purposes because of its active substance carvacrol. For example, in an animal study, carvacrol has been found to increase concentrations of serotonin and dopamine, two hormones that regulate mood, which means you can also use thyme's essential oil in mood disorders such as depression. And if you use thyme or its essential oil regularly, it might have a positive effects on your feelings and mood. Still more studies are needed to support this finding. In another study, a combination of thyme and ivy leaves helped to alleviate coughing and other symptoms of acute bronchitis. Its essential oil can be used topically or via inhalation in bronchitis. I want to also mention about thyme because it has a bronchodilator effect. I mean, it's essential oil. You can inhalate, especially the children also can inhalate its essential oil while suffering from bronchitis. You know, most of the bronchitis in the child period are caused by viral agents. So antibiotics do not are not useful in those patients. Mostly, we only treat them with I mean symptomatic. We only can treat them. But here, thymus oil is very useful and beneficial. How we use it? We can use the herb by infusion, which means we can prepare tea by boiling the by pouring the boiled water on it. We can wait up to 10 minutes here. The amount of the herb we have to use about 2 grams of thymus to 200 milliliters of water. If you, for example, want to drink more than 1 cup, you can use this formula: 2 grams for 200 milliliters of water. You can drink up to 3 cups a day thymus thyme tea, and also you can use its essential oil. I want to mention here one important point: essential oils are mostly cannot be used internally. I mean, you cannot use it orally. You can either have to use it topically by applying to the skin, or you can inhalate it. Okay, please.
Thank you so much, my dear Professor Süleyman. And really, the way you are dealing with different herbs make us feel that this is a real medicine. Dr.
Yes.
Dr. Heba has a comment. We use those herbs in food, then cook it. It is still as beneficial. Okay, I will let Professor Süleyman. There is a question in the chat by Dr. Heba. Would you please read it? And
yes, I do read it now. Yes, she is right.
okay.
Those herbs which have been used for centuries as a spice, or as a food, also can be used by adding them to our daily foods. As I mentioned, ginger, curcumin, and thyme also. When we use them in our salads, in our soups, we will still benefit from it.
Okay, thank you so much.
It is better to use them as a food in preventive medicine.
Yes. Okay. Coming back to الزعتر. So دكتور سليمان أكد على الزعتر واستعماله في التهاب القصبة الهوائية، برونكايتس، خاصة في الأطفال، حيث أن السبب هو فيروسي. يبقى من الأفضل استخدامه، وإن هو بوجه عام له تأثير ضد الالتهاب، وتأثير مش مؤكد منه ان هو ضد الاكتئاب. فاحنا يعني انا شخصيا اكيد هبقى حريص جدا ان الواحد يجيب كل الهيربز دي، واؤكد تاني ان من الواضح ان الموضوع له جرعه وله طريقه استخدام. هو مش مثلا ايه كوبايه شاي بناخدها، لا، له دوز وله طريقه. Okay, thank you. Would you please continue?
The next herb is Coriandrum sativum. I still experienced. Okay, it's going on. We call it kishnish in Turkish. I don't know what's its name in Arabic, but it's also a very common herb, also used as a spice tradition in this area. It grows wild in Anatolian region, but it's also cultivated. One of the herbs which is also cultivated and cultured in Turkey, especially in Burdur and Konya, one of the two famous cities of our country. It contains essential oil with including this Coriandrum sativum also contains camphor, geraniol, and geranyl acetate. It is mostly used for digestive purposes because it has stomachic, spasmolytic, and carminative effect. Carminative means which decreases the distension caused by excessive gas in our gastrointestinal system. And these properties are caused by mostly its essential oil. It is also used for gastritis, diarrhea, dyspepsia, and colic pain. When coriandrum is added to laxative herbal preparations containing anthraquinone, anthraquinone is mostly found in Sinameki. I think it's the same name in Arabic, to prevent colic pain. Anthraquinone causes sometimes colics and spasms while using it for laxative purposes. When you add coriandrum to this herbal preparation, you will decrease the side effect of Sinameki, for example. A review on the medical aspects of coriandrum, it has been stated that it has stomachic, spasmolytic, and carminative properties. Plus, it shows antihelmintic, antioxidant, diuretic, anticonvulsant, and antidiabetic and sedative activity. How to use? We just use 1 teaspoon of the crushed rock and brew it, infuse it, prepare tea it for 15 minutes because it's a little bit hard rock. You have to at least wait after pouring the boiled water on it at least for 15 minutes. After filter the tea, you can drink its tea 3 cups a day. Yes, please.
Okay, thank you again, Dr. Süleyman. We have 2 questions. I think they are very important. One of them is raised by Dr. Miranda. She's saying, in English, is mixing herbs will cause some sort of synergism or it is harmful? And the second is by Professor Rabab. She is asking, ثايمول اللي هو بالعربي انا ما اعرفش ترجمته، هي بتقول الكزبره is very irritating in young ages. So now we have a comment and a question. The question is asking about mixing herbs.
Let me answer the question first.
Yes.
This is a very question, and it's very important in phytotherapy. Actually, I have added some prescriptions at the end of this lecture, but I am afraid we cannot, we will be not able to come to the end of the lecture because of the time limit. But preparing herbal mixtures, herbal prescriptions while making an herbal tea is very important because, for example, this is a good example. This is a very common in our country as well as in your country because it's grown in Arabic Peninsula. I mean, this famous plant, Sinameki. Do you use the same word for it, Professor Yusuf? Sinameki?
I don't know actually.
Cassia angostophila, I think it's the Latin name. It's the famous plant grown in Saudi Arabia, and it's used for laxative purposes. And
yes, for laxative, yes, Sinameki,
yes, Sinameki, yes. This is a plant which includes high amounts of anthraquinone, which is an ingredient on it. But if you add some other herbs to it, you will decrease the side effects revealed by this component of Sinameki. In general, what I want to explain, when you prepare a herbal tea, you can add up to 5 different herbs to one herbal tea. One or 2 of them will be the main ones which will exert the main activity, the main effect, but the other 2 or 3 herbs will be added to this mixture to decrease some side effects of these two main herbs, and of course some to reveal some synergistic effects. This is the main manner, this is the main way how we prepare herbal prescriptions. This is very important in phytotherapy. Let me summarize it.
Okay, I think after the next herb we can shift to some examples, and we may complete the lecture in another session. But it's very important, as you said, to give a model of mixing. And I have the comment regarding what you call simul herb. الكزبرة is very irritating in young ages. Do you agree with this comment, Professor Süleyman?
Which one, Timur?
Simul herb.
لا ثايمول اللي هو الزعتر يا دكتور محمد، مش ال.
You mean it's essential oil?
لا يمين الكورياندر، ذا كورياندر.
Coriander? Coriander or zahter? Which one?
No, she fixed it. She asks about coriander herb is very irritating in young ages.
Actually, I haven't heard about it, but coriander should be used, of course, in its therapeutic doses. It's better not to exceed the therapeutic dose. But coriander, some people do not like its scent, that do not like its taste. You can skip coriander for those people who are sensitive to coriander. But in coriander also is a detoxifying herb. For example,
again, I'm sorry, Dr. Heba is saying she is re-emphasizing that she meant simul herb is very irritating. Do you agree with this, Professor Süleyman? Simul herb?
Are we talking about coriander or thyme?
No, simul.
Okay. That's what I understood first, but Mahmoud Jamil said it's coriander. Okay. Timu's essential oil is irritating. Yes, it's right.
Okay.
Essential oils. Yes.
Okay. So we will give answers to the comments at the end of the lecture.
Yes,
so because time is running. So please, we will shift to next herb.
The next one is Ocimum basilicum, which is basil. It's known as Rayhan. I think it's also mentioned in Surah Ar-Rahman, Zul Asfi wa Rayhan. And it's one of the hadith in Nabi Sallallahu Alaihi Wasallam. He says, whoever is offered basil should not refuse it. It's because it's from heaven. The basil's leaves are used in medicine and as food. It is the eugenol in its essential oil that gives its classic scent, classic aroma. In addition, essential oil components include citranols, linalool, and camphor. And other components are many phenolic compounds such as caffeic acid. Its antiviral, antimicrobial, and antioxidant properties have been shown up to date, and there are also studies showing that it may be beneficial in cancer. It has been shown in mice that it prevents platelet aggregation and thrombus as well. Traditionally, this is important, it is used to increase breast milk. It improves gastric, intestinal, and digestive problems, cramps, and colic. It can soothe nausea and kill intestinal parasites. And also it's used in cases of anxiety, depression, tension, and insomnia. This plant is a little bit different than other aromatic plants. This is also a plant which is used, one of the plants which is used in mood disorders such as depression, because it increases the mood level. The topical use of fresh leaves reduces itching and inflammation in insect bites. It has been reported that it has been used in respiratory infections, ear, tooth, and throat pain and asthma. Its expectorant properties are known. Chewing its fresh leaves is beneficial for oral wounds, and the juice, its fresh juice, obtained from its leaves is used for kidney stones, and it is famous for its use in fever and cough in Africa. How to use this herb? This is also a very well-known herb, I think, in Egypt and in this area. You have to use 2 grams of the herb with a ratio of 1 cup of water. You have to infuse and use it as a tea. Up to 3 cups a day you can use this herb, I mean rayhan, per day. Yes.
اوكي محمود، لو عندك ترجمة. هو اسمه بالعربي ريحان. محمود، عندك ترجمة ولا نشيفت على اللي بعده عشان خاطر الوقت؟ محمود عندك مشكلة؟ طيب اوكي دكتور سليمان، would you please, because I want to finish in 10 minutes, so please.
Okay, I will finish. And 10 minutes I will finish. Okay.
Okay.
I just want to mention as the last herb from olive. It is very well known. Olive,
Yes.
Olive Europea.
Yes.
And it's, you know, is vettine with zeytun. And also Rasulullah Sallallahu says, eat olive oil and anoint yourself with it because it's from a fruitful tree. It's a food with high nutritional value. It contains plenty of vegetable proteins, fat, vitamins, etc. And it is the main element of the Mediterranean diet, which is considered a miraculous diet for cardiovascular health. This is very important because in current medicine, Mediterranean diet is very famous and it is well known and very much mentioned because it's very, very beneficial for cardiovascular prophylaxis protection. But here, one thing we forget to mention, what is the main component of Mediterranean diet? It is olive oil. When they talk about Mediterranean diet, they say that they eat a lot of vegetables, a lot of salad, fish. Yes, these are right. But which is important here, only olive is specific and endemic to Mediterranean. In all over the country, you can find fish, vegetables, salads, etc. But olive is only naturally grows in only the Mediterranean area. So when we are talking about Mediterranean diet, we should emphasize, highlight the potential and importance of olive, or especially olive oil, while we are talking about Mediterranean diet and its uses. Okay. It also reduces the effects of aging, and olive oil refreshes the skin when used topically for dermocosmetic purposes. For example, it prevents hair loss, it strengthens hair, and it removes wrinkles. When we come to olive oil, as you know, olive oil as completely obtaining olive oil is completely physical and does not involve chemical methods. So it's a natural oil. And it is noteworthy that in Mediterranean countries where olive oil is consumed in high amounts, cardiovascular diseases and cancer cases are at lower rates. In recent years, it has been determined that other vegetable oils are not as beneficial, even very harmful when compared to olive oil. And this sentence is important. The healthiest oil we can use in food, salads, and for cooking is olive oil, and olive oil must be considered as a medicine rather than a food. I want to go to the next slides because I want to also talk about a little bit about olive leaf, and extracts and tea prepared from olive leaves are also used in many diseases. It has been proved scientifically that the active ingredients oleuropein and eleonic acid contained in the leaf acts as antimicrobial agents. And olive leaf extract is an extremely useful herbal source for some clothes for common colds, flu. For example, even there is a study which has been conducted in our country revealing the efficacy of olive leaf extract in COVID-19, for example. And like olive oil, leaf extract is also a good heart friend. For example, there are studies showing that it has anti-diabetic and blood sugar regulating effects. It reduces also high blood pressure to normal levels. Olive leaf, I mean the leaf of the olive plant tree, is also a very powerful antioxidant. It strengthens the body and the immune system and provides protection against diseases transmitted by viruses. For example, it's also beneficial in viral infections, upper respiratory tract infections, and etc. And also, if you use it externally, you can use it to clean wounds from germs. How can we use it? You can drink olive oil, the fresh one, the raw one, uncooked one, before meals up to 50 milliliters a day, and or you can use it topically. And as for its leaves, you can use 3 grams of leaf. You can use fresh leaf or dried leaf with a ratio of 200 milliliters water. You can infuse it, I mean, boil the boiled water, wait up to 10 minutes, then filter and drink it up to 3 cups a day. Okay.
Thank you so much. This is, I think, the last herb, but not the least, because
we can,
really,
inshallah, make another session.
no, yes, we need to, yes, we will speak about after this chamomile and vaccines, and I want to state some few words. Number one, I was honored to go to Gaza 2 times, 2008 and 2012. They used to use olive oil every day. I may say every meal. دكتور سليمان actually تحدث على فوائد زيت الزيتون، وانه انا بالنسبه لي مع ان الاريا او ماي ورك اوبيستي سيرجري، قصه ان هو essential part of Mediterranean diet. يعني زيت الزيتون essential part Mediterranean diet. This is the best kind of diets used anti-aging, anti-obesity, anti-cancer. Thank you for highlighting this. النقطة الثانية المهمة استعمال ورق الزيت واستعماله التوبيكال كانتيسبتيك. دي من الدايمنشنز الواحد ما كانش واخد باله منها. فقصة الاستعمال كشرب، الاستعمال توبيكال موضعي كحاجة ضد الفيروسات، يعني حقيقة يعني فوائد عديدة لزيت الزيتون، وإن هو يعني جزء أساسي من الميديترينيان دايت اللي هو أفضل أنواع الدايت متفق عليه عالميا. أنا بس هطلب من دكتور سليمان يدينا نموذج لوصفة. Professor Süleyman, if we please ask you to share one of 2 prescriptions or how to write.
I've just come to that slide.
And after this, I will ask Dr. حنين الجندي المجهول في تنظيم هذه المحاضرة to share a translation after this. So we will start by Dr. Süleyman, please.
Okay, I have included to my lecture some examples from herbal prescriptions. I want to start a prescription for upper respiratory tract infection, which is very effective in common cold, which decreases the main symptoms such as cough. Here, K stands for kısım. I think the same word we use in the Turkish is also an Arabic origin. 80 kısım means the ratio we show here. You can take it as grams, or you can take it with your fingertips while preparing the herbal tea. Here we use 2 herbs here. The main one is salvia, which is sage, up to 80 kısım, and menta is nane, which is mint, up to 20 kısım. I mean, what I mean here, if you add 2 grams of nane, you have to add 8 grams of sage to do same tea. You just make the herbs, mix them, and then we take 1 tablespoon from this mixture and infuse it with 150 milliliters of water. We have to infuse it, make a tea after waiting for 10 minutes, and we can drink 3 and 4 cups a day when we get common cold. This is also the herbal prescription also can be used in children. Okay, the next one also in upper respiratory tract infections, it is matricaria. I think it is babunaj in Arabic. The next one is salvia, sage, followed by nana, menta. Melissa, I don't know what you call it, but it's very well known with its Latin name in Turkey, and I am sure in your country also. It's one of the best, one of the herbs which I use most in my practice, daily practice. And Aurantia pericarpium is the peels of the lemon. When you mix these 5 herbs with a ratio of 20 kısım from babunaj, matricaria, 20 kısım from sage salvia, 10 kısım from nane, 5 from melissa, and 5 from lemon peel. You just mix this herbal prescription. From that, 2 tablespoons, sorry, I haven't translated to English, 2 tablespoons from this mixture with a ratio of 250 milliliters of water. You have to infuse it up to 20 minutes. Then you can drink from this tea 2 or 3 cups a day. Both upper and lower, I mean upper and lower respiratory tract infections, including bronchitis, you can use Altea radix. We call it hatmi in Turkish. I am sure you use the same word in Arabic. Licurity radix, unfortunately, we couldn't come to those slides. Is one of the main drugs which is cultured and cultivated in our country and sold and exported. We call it mayan. I will show inshallah in the next session.
Okay, thank you so much for
this mixture. Also can be used for bronchitis. 4 herbs here. You make the mixture and infuse it for 10 minutes, and you can drink it up to 3 cups. Okay. I think we have to finish here, Professor.
Okay. Meanwhile, would you please stop sharing, as Dr. Hanin will share 1 or 2 prescriptions in Arabic. At the same time, I had a question from Dr. Heba. She's asking, we want to understand the difference between the quality and grades of olive oil. She is asking about, I mean, how to say this brand of olive oil is better. For example, it's pure, not pure, something like this. If you can just give some tips about how to choose a good type of olive oil, I think she wants to know. Before buying, she's asking before buying, for example, how to choose good types of olive oil. I mean color, thickness, taste, something like that.
Actually, I am not very professional expert in this subject, but it should be, as I mentioned in my slides, it should not. They should not use any chemical process while preparing olive oil. It means they must not heat it. It should be cold pressed. Only with mechanical ways they have to extract the oil from the olive. Otherwise, it will lose most of its phytonutrients and will decrease the therapeutic purposes of the olive oil. You should be careful. Any brand, I cannot advise any brand here, but when you buy an olive oil, you should be careful that it should be prepared by cold pressing way.
Thank you so much. Thank you so much. دكتور حنين ممكن تشير Arabic prescription؟ دكتور حنين معايا؟ لا، لو في صعوبة تكنيكال هنخليها للمحاضرة. طب اوكي، برافو عليك، هايلة.
السلام عليكم.
عليكم
Thank
السلام.
you,
اهلا
Dr.
وسهلا.
سليمان, so much for this amazing content. دكتور سليمان كان قال مثال من شوية في upper respiratory tract infection اللي هو عدوى الجهاز التنفسي. كان قال إن إحنا ممكن ندي مجموعة من الأعشاب مع بعض اللي هي البابونج والمريمية والنعناع والعسل والليمون، كلها من كوبين لثلاث أكواب يوميا. ممكن يستخدم لمدة أسبوع علشان إن شاء الله يعالج التهابات الجهاز التنفسي والعدوى البكتيرية. كان برضو من بعض الأمثلة اللي كانت ذكرت خلال المحاضرة كان زي الزنجبيل، إن هو ممكن يستخدم استخدامات، إن هو بيستخدم كمسكن للألم. الجرعة اللي ممكن تستخدم إن إحنا ممكن نقطع الجذور من 2.5 جرام، وبيتم سحقها وبعد كده بتضاف لكوب من الماء. بيتم غليها لمدة 5-6 دقائق، وبعدها بتتصفى وبتتشرب في درجة حرارة متوسطة، يعني إنها ما بتكونش درجة غليان ولا تكون بارد. بيتشرب من 2 ل3 مرات في اليوم، وبيستخدم عشان تسكين الألم. لو كان حاجة ألم مزمن زي آلام المفاصل، ممكن إن الجرعة تزيد فترتها، زي مثلا مدة من أسبوعين ل3 أسابيع عشان يبدأ يكون في ملاحظة لنتيجة تسكين الألم. لكن في الطبيعي هو بيدي مفعول بعد ساعة ل2 من شرب. بيكون آمن الاستخدام زي ما ذكر في المحاضرة من خلال دكتور سليمان. ده بعض الأمثلة اللي إن شاء الله هيتم عمل بريسكريبشن ليها كملخص للمحاضرة، ويتم نشره إن شاء الله على قنواتنا وجروبات الواتساب بتاعتنا.
شكرا جزيلا دكتورة حنين، فعلا نموذج هايل. واعتقد احنا محتاجين زي ما تفضلت كده ان احنا نترجم المحاضره لعدد من البريسكريبشنز باللغه العربيه، عشان يعني الناس في المناطق اللي هم محتاجينها سواء جوه مصر او بره مصر يبقى قدامهم وصفات واضحه ويقدروا ينفذوها. شكرا جزيلا. Again and again, I thank you, my dear brother, Professor Süleyman, for this wonderful lecture. And hopefully we will arrange a second session so that you'll be able to complete and answer any question.
Okay.
And thank you again. Thank you so much.
I am waiting with impatience for the next session.
Inshallah.
I also thank you again for providing me this opportunity to share my a little bit knowledge.
Thank you. So you are very humbled, my dear brother. Thank you. Ramadan Kareem.
Inshallah, I have been useful for our colleagues.
Sure. Alhamdulillah.
And as one word I have to mention,
yes,
those Zionists are not killing us with bombs only. Compared to bombs, these Zionist medicine and degenerated and which has been changed genetically food are killing us much more than those bombs. Please, we have to focus on our traditional medicine and our traditional drugs, mainly prepared from those natural herbs.
Thank you so much, my dear brother. وبشكر طبعا الدكتورة حنين جندي المجهول وكل الفريق الرائع بتاعنا والمهندس محمود على مجهودهم. And I thank you again, my dear brother. And رمضان كريم وكل سنة وانتم طيبين جميعا. صباح على ألف خير وإلى لقاء قادم إن شاء الله. السلام عليكم ورحمة الله وبركاته.
عليكم السلام.